So today, March 12th, 2020, the World Health Organization has informed us that we are now officially in a pandemic, though that's something we've all actually known for some time. But now it is official. So at this point, of course, we don't know exactly how it will all turn out. But as Americans, at least, there's one thing we do know. Even at this early stage, with just a few hundred cases of COVID-19 in the United States, we know that our medical establishment has failed completely to prepare for a pandemic. Yes, we're expecting an overload of the healthcare system, and frankly, that's inescapable. There's no way we could constantly maintain the kind of medical facilities and staffing required for us to not have some kind of overload in a time of a pandemic. But there are some areas of preparation that would be rational and possible for our medical establishment, both the public and private spheres of that establishment, to have in place ahead of time. So, for example, there could be a sufficient stockpile of things like masks and gloves and scrubs and goggles. All that protective gear that will be needed by medical personnel, so they have at least a minimal protection from the virus as they treat the oncoming onslaught of sick people. But as we all know by now, they don't. And here's the thing, everybody has known this was going to happen. Not necessarily that it would be a coronavirus, though that's long been recognized as a likely culprit the next time a pandemic did happen. And not necessarily that it would come out of China, though that was also a possibility, and not necessarily that it would happen at this time, starting at the end of 2019. But a pandemic, sometime, sooner or later, was going to happen. And what are some things the healthcare system is absolutely going to need when a pandemic happens, regardless of what virus, where it originates, and when it happens? Oh, I don't know, things like masks and gloves and goggles. Whatever germ it is, you're going to need those things to protect the healthcare workers who are caring for sick people. So now, forget whether the system will be able to adequately care for you and your family if you get sick. It can't even protect its own people. In the coming months, there will be doctors and nurses, orderlies, janitors, food servers, treating and caring for people with this disease, and they're not going to be protected against it. Now, about you. Let's imagine you don't get the virus. That's not what happens to you. Instead, you have a car accident, or you fall and break your leg. Now you need medical attention, and you're going to be treated by whom? Will it be someone who's been treating COVID-19 patients? The nurses, the doctors, the paramedics who come for your call? Will they have been treating patients with COVID-19, and will they have had proper protection? In the next few months, maybe longer, if you or I need medical treatment for anything, maybe we'd better be prepared to get some coronavirus along with our treatment. And the lesson from this is also something that we've known all along. The only person you can trust to take care of you when the poo hits the fan, in whatever way that happens, is you.